Welcome to Rewriting the Risk, Thriving After Breast Cancer, and the second part of the Vitamin D Trilogy. I'm Dr. Gerda Edwards, and today I'm going to be talking about why higher doses of vitamin D may not be moving your test results. I've seen this with so many clients over the years. Well, like many supplements, vitamin D must go through a process in the body before it can be used, but it has its points of failure. So let's look at the path and see what those points may be. Let's start with step one. So you take the capsule supplement. Remember, vitamin D is fat soluble, so taking it with some fat like avocado, olive oil, or nuts makes a really big difference. But here is the issue. If you have conditions such as low stomach acid, which is the biggest culprit, or fat digestion issues, chronic stress, if you're using a proton pump inhibitor or have an H. pylori infection, this can become a roadblock and disrupt the process at this point in vitamin D's journey. Step two, then the small intestine picks up vitamin D and it gets carried into your lymphatic system and your bloodstream. The small intestine absorbs vitamin D through tiny figure-like projections called villi. When the villi are damaged, the surface area collapses. But what causes this damage? Well, it could be celiac disease, chemotherapy, SIBO, NSAIDs, gluten, just to name a few. But I'd like to emphasize that chemotherapy is one of the most aggressive villi damaging mechanisms, and the gut lining can take months to years to fully recover. Well, up to now, we've talked about the stomach, the small intestine, the lymphatic system, and the bloodstream, all getting involved in vitamin D processing. But at this point, what can you do if you have any one of those roadblocks that I mentioned, or perhaps other roadblocks? Well, you can take a sublingual form of vitamin D that bypasses these steps. It absorbs directly through the mucous membrane into the tiny capillaries below the surface. And from there, it goes into the bloodstream. So I've explained two paths to get to this point. One, a capsule supplement, and the other, sublingual vitamin D. So moving forward from the bloodstream, it finds the liver, where it converts 25-hydroxyvitamin D, which is the storage form that shows up on your blood tests. The kidneys then take that storage form and converts it into a fully active hormone called calcitriol. That's a mouthful. This is the form that goes into your cells and does the work. These two steps, though, aren't without potential to roadblocks, which could be a fatty liver, liver disease, magnesium deficiency, statins, insulin resistance, kidney disease, low phosphate, or chronic inflammation. And these conditions could be keeping you from absorbing vitamin D. And if that's the case, please seek medical evaluation. So I've talked about the vitamin D's journey in the body, from the mouth to the stomach, to the small intestine, to the lymphatic system, the bloodstream, and the liver, and finally the kidneys. And this is a very, very, very general overview designed to give you an idea on what may be behind vitamin D numbers staying low. Your call to action is to be curious as to why you may not be absorbing vitamin D. This vitamin is a power horse against cancer, and you don't want to miss out helping yourself reduce the risk of reoccurrence. Let's resolve that vitamin D absorption issue. Next up is the last episode in the trilogy, the vitamin D aisle, where hope meets a confusing label. See you next time. Stay strong, stay thriving, and stay informed.